Welcome to our presentation on the female reproductive system. This project was created by Lily Agnew, Danielle Ambrose, Anelia Balcaran, Shauna Blaze, and Kaylee Brown. The female reproductive system is a complex network of internal and external organs uniquely designed for creating and nurturing life. It plays critical roles in hormone regulation, ovulation, fertilization, pregnancy, and childbirth, and also influences overall health through its connection with the endocrine system. Anatomically, the system is divided into internal and external structures. The internal organs include the ovaries, fallopian tubes, uterus, cervix, and vagina, all working together to support reproduction. Externally, the vulva includes the labia majora, labia minora, clitoris, and vestibule. Understanding these parts is key to understanding female reproductive health. By the end of this presentation, you will be able to identify key reproductive structures and their locations, explain their functions, and recognize signs and diagnostic criteria of polycystic ovary syndrome, also known as PCOS. Let's begin with the ovaries. The ovaries sit on either side of the uterus. They produce eggs or ova and secrete the hormones estrogen and progesterone. Estrogen plays a vital role in regulating the menstrual cycle and developing female characteristics. The fallopian tubes connect the ovaries to the uterus. This is typically where fertilization occurs. Tiny cilia within the tubes help guide the egg toward the uterus. The uterus is a hollow, muscular, pear-shaped organ. It is where the fertilized egg implants and develops into a fetus. The endometrium or inner lining thickens each month and sheds during menstruation if fertilization does not occur. The cervix is the narrow, lower portion of the uterus that opens into the vagina. It produces mucus that can help or block sperm movement and dilates during childbirth to allow for delivery. And finally, the vagina is a muscular canal extending from the cervix to the outside of the body. It serves multiple roles. It's the birth canal, the exit for menstrual flow, and the receptacle during intercourse. So here we have some female genital anatomy. The first image shows both internal and external reproductive structures, while the second diagram highlights the uterus, fallopian tubes, ovaries, and vagina. And this is an anatomical view of the same. Image 1 gives us a sagittal view of the pelvis, showing the relationship between the reproductive, urinary, and digestive systems, while image 2 shows an anterior view focusing on internal reproductive organs. Now let's talk about some of the external female genital anatomy. First, we have the vulva or clitoral hood, which is a fold of skin that covers and protects the clitoris, and is similar to the foreskin seen in males. The clitoris is a small, highly sensitive organ made up of erectile tissue and important for sexual pleasure. Next, we have the outer labia or labia majora, which is the larger outer folds of skin that protect the genital area, and they may have pubic hair. There is also the inner labia or labia minora, which would be the thinner inner folds of skin inside the labia majora that protect the vaginal and urethral openings. Finally, we have the urethral opening, which is the external opening of the urethra through which urine exits the body. And we have the vaginal opening, which is the entryway to the vagina, located below the urethral opening. This is a label diagram of the external genital anatomy that we just discussed. We can see the clitoris, the labia majora, labia minora, the urethral opening, and the vaginal opening. Now let's explore a real-life case study of polycystic ovary syndrome or PCOS to better understand this condition in action. What is PCOS? Well, PCOS is a hormonal disorder affecting 1 in 10 women of reproductive age. It disrupts the hypothalamic pituitary ovarian axis, causing the ovaries to produce immature follicles that don't ovulate, leading to chronic anovulation. Meet Shauna Blaze. Shauna is a 37-year-old female who was diagnosed with polycystic ovary syndrome at the age of 17. She has experienced irregular menstrual cycles since the onset of menarche at the age of 12. Over the years, she has reported persistent symptoms commonly associated with PCOS, including hirsutism, which is excess facial and body hair, unexplained weight gain, and infertility. These symptoms have significantly impacted her reproductive health and her overall well-being. Her ovaries don't look like regular, healthy ovaries. Instead of releasing one mature egg each cycle, Shona's ovaries are filled with multiple small follicles, a classic sign of polycystic ovary syndrome. As you can see in the ultrasound image, these follicles appear like a string of pearls along the edge of the ovary. Compared to a normal ovary, which contains only a few small follicles and maintains a typical size, Shona's ultrasound shows multiple immature follicles arranged along the edge of an enlarged ovary, which is a hallmark sign of polycystic ovary syndrome. Shona began trying to conceive in 2012. Her HSG results were normal and her partner was medically cleared. She lost 30 pounds but still didn't ovulate. Metformin was prescribed, but it failed to induce ovulation. After 2 cycles of clomiphene, Shona successfully became pregnant, ending a 4-year fertility struggle. Shona faced many issues with fertility, as her irregular ovulation made it difficult for her to conceive naturally. In PCOS, hormonal imbalances often prevent the ovaries from releasing mature eggs, which is why ovulation does not happen regularly or even at all without medical support. After Shona gave birth in 2016, things looked hopeful, but her cycles only returned for a short time. For the next 4 years, there was a complete silence from her ovaries. By 2022, a follow-up exam showed no endometrial thickening, which tells us that she was not ovulating at all during that time. Shona's ovaries were not releasing eggs regularly, and that is what we call chronic anovulation. Because of this, her uterus was not going through its normal cycles. So what is happening here is a disruption in her HPO axis, which is the system responsible for controlling hormone signals between the brain and ovaries. Frustration, failed treatments, and fertility stress took a heavy toll on Shona's mental health. Ongoing struggles affected her self-esteem and her motivation in everyday life. She also experienced emotional isolation, feeling alone in a journey many don't fully understand. But Shona didn't give up. She made big lifestyle changes: intermittent fasting, clean eating, and regular exercise. She also worked on her emotional healing through her faith and journaling. By 2024, she had seen progress. Her cycles were now returning every few months. Today, while Shona's cycles are not perfect, they are more consistent than they have ever been. She is now focused on healing, not just physically, but emotionally and spiritually. Her journey has shifted from just trying to conceive to learning how to care for her whole self. Shona's story shows us that PCOS isn't just a temporary issue. It's a chronic condition that needs long-term care. Medications helped her get pregnant, but it was the lifestyle shifts that brought steady progress. In the end, everything came back to one thing: ovulation. If the body is not releasing eggs, the whole cycle falls out of balance. What can we learn? Well, PCOS, or polycystic ovary syndrome, is a common reproductive disorder rooted in chronic anovulation, affecting hormonal balance, cycles, and fertility. And while medication can help temporarily, sustainable change often comes from lifestyle and emotional healing. Finally, Shona's journey reminds us that reproductive health is not just biological, it's deeply personal, and we must always respond with empathy, education, and support. We thank you for your time, and we hope you thoroughly enjoyed our presentation.